This is Dr. Stephen Myers. I'm the bariatric surgeon at Fresh Start Bariatrics at Riverside Hospital here at Columbus, Ohio, and I'd like to speak to you about why I believe a gastric sleeve works well for patients if they select that operation. Gastric sleeve is a newer operation. It's been around about 7 years or so. I've been performing that operation for a little over 2 years and probably have done somewhat over 100 operations by now. Patients do seem to do very well after a gastric sleeve operation. In fact, our patients lose about 70% of their excess weight at a year after a gastric sleeve procedure, and people are very happy with that operation most of the time. So I'm pleased to explain to you how I believe a gastric sleeve works. A laparoscopic gastric sleeve operation is an operation that creates a tube out of the stomach. A tube maybe the size of a small banana or a thin banana. It's about as big in diameter as your thumb and about as long as your index finger, maybe a little bit longer. And the way we create that tube or sleeve of the stomach is we use stapling devices to divide completely across the stomach from close to the outlet of the stomach to the inlet of the stomach. The rest of the stomach is completely separated from that, and in fact it's not connected to anything, so it has to be removed from the abdomen. Therefore, when you swallow food, it goes directly from your esophagus into this small gastric tube or sleeve and stays there for a time and is slowly emptied out of the stomach. You cannot eat the same volume of food that a person that has not had a gastric sleeve can eat at any one time, and that works very well for patients. There are some reasons why I think this works so well. First of all, it's really creating a small gastric pouch. It's that sleeve. There's a limited amount of food that you can take in at any one time. Secondly, I believe it decreases the amount of hunger that you have as well, because a lot of the stomach that would produce a hormone that makes you hungry at breakfast, lunch, and dinner called ghrelin is no longer there. That portion of the stomach, a lot of it is gone, so I think the hunger level goes down as well. But patients do very well after having a gastric sleeve procedure. This is a procedure that is done laparoscopically. Generally, the patient comes in to have their operation. 2 days later, they leave the hospital, and they just seem to do very well, and they lose weight at a rate about the same as a gastric bypass operation for about 1 year, and then level off at 1 year and stay about wherever they are at the end of that 1 year. And for our practice, it's probably somewhere around 70% of their excess weight, maybe more than that at the end of a year. Now, there are some advantages of having a gastric sleeve. One advantage is that there's no rerouting of the intestine. There's no cutting across the intestine or anything. There's only division of the stomach. And therefore, when you swallow food, and it leaves the stomach, it goes into the small intestine, and you don't have to take multivitamins and calcium all the time like you do after gastric bypass operation. Still, it's a great idea. I think you should take you should take a multivitamin and calcium each day if you can, but it's not as necessary as if you had a gastric bypass operation where the intestine has been changed. Also, there's no concern about a foreign body such as a band. It's similar to a band operation in some ways in that it's restricting the amount of food that you can eat at any one time, but it does not rely upon a foreign body such as that band, and some people find that appealing. Another advantage is there's no need for an adjustment like there is with the gastric band. That has to be adjusted periodically, but a gastric sleeve operation kind of has its own adjustment in that the muscle at the outlet of the stomach is adjusting how much you can that will leave that sleeve at any one time. Finally, there are no foods that you cannot eat either after gastric sleeve or a gastric bypass operation. Certainly you have to change the quantity and sometimes the composition so you're not taking in as much carbohydrate, but still there are no foods you cannot eat. So I think that's another advantage of that operation. There are some disadvantages of having a gastric sleeve operation. One is that you are stapling across the stomach, so there is certainly a possibility of having a leak of gastrointestinal contents across that staple line. It's very uncommon, but it can happen. If that happened, then you would have to have a tube placed into the abdomen usually, and that fluid taken out and be placed on antibiotics and IV nutrition for a period of time. Usually that's a few weeks before that all heals. So it only happens maybe 1% of the time, but it is a possibility after having a gastric sleeve operation. Secondly, that tube or sleeve of stomach that's only about the diameter of your thumb can become narrowed. It's not common, but it can happen, and therefore that can either be stretched with a balloon, or sometimes the operation has to be converted to a different operation if a stricture or a narrowing occurred. Again, that's very uncommon, probably only 1 or 2% of the time, but it can happen. Another disadvantage of this operation has to do with gastroesophageal reflux. If you have severe gastroesophageal reflux, probably the best operation in the world is a gastric bypass operation, because after the bypass there's just nothing there to reflux for most people. After gastric sleeve operation, you do have the amount of food that can be placed in the sleeve that could reflux up into the esophagus. My general impression is that if a person has reflux after a sleeve operation, they can stay on something like Nexium or Prevacid or something like that for some months until their weight comes down, and then generally that reflux will go away and not be a long-term problem. But reflux is possible after having a gastric sleeve operation. Probably the biggest disadvantage of having a gastric bypass is we just don't have information that says that this is safe for the next, over several decades. A gastric bypass has been around since 1967. Gastric bands have been around since 1985. So we have all that information. A gastric sleeve has only been around for about 7 years, so we don't have long-term information. However, I think because a sleeve was incorporated in a different type of operation called a duodenal switch operation, I think we have quite a bit of information that says that this is going to be successful long-term, although we just don't have that long-term information about doing a gastric sleeve without an intestinal switch or anything. So we have good reason to believe this is going to be a good, successful operation, but we just can't quote you statistics that are out 1 or 2 decades from people that have had this operation. Also, some insurance companies don't approve a gastric sleeve procedure right now. Many do, some don't. That can be a problem for people and could be considered a disadvantage. And finally, it's not reversible once you have a gastric sleeve operation. You certainly can convert it from a gastric sleeve to something else like a gastric bypass or a duodenal switch if it was necessary to reconstruct it, but it's not reversible in that we don't keep that stomach on ice waiting for you to make a decision and then put that stomach back if you decide you want that back. That's not possible, of course. So it is not reversible, but there are different ways of dealing with a problem that a person might have after having a gastric sleeve if it was necessary to make a conversion or a change. I will tell you that a gastric sleeve operation originally was designed to be the first stage of a 2-stage operation. Often they would have a gastric bypass, have a gastric sleeve done, lose some of their weight, come back and have the second portion of an operation called a duodenal switch operation, or they could be converted to a Roux-en-Y gastric bypass. What we found, though, is that most patients lost so much weight with just the sleeve that they didn't need the second phase of the operation. So today, it's offered in our practice to anybody that wants to have a gastric sleeve procedure if they meet criteria for a bariatric operation.